Hey there, I'm Dr. Jill Wener. Welcome to part 3 of the 7-day coronavirus emotional survival kit for healthcare professionals. Thank you so much for joining me. I hope you're finding this series helpful. I know there's a lot of major emotions going on. There's a lot of complicated emotions. So let's just get right back into it. Thank you again for everything that you do. And also, as I like to say every time, this is not medical advice. This does not substitute for getting appropriate mental health care if you're feeling like things are a lot more serious than what you feel like you should be feeling in response to this. So please do reach out if you feel like you need help to a mental health care professional. Today we're going to be talking about worry and fear about the logistical complications of this virus. Yesterday we talked about worry and fear and anxiety and panic about health and getting the virus and the health of your loved ones. So I'd like to read to you a few of the things that some of the women, that some of the doctors wrote in that I interviewed. They're feeling some uncertainty and anxiety about their youngest daughter still at their dorm and needing to come home for the remainder of the semester. I'm scared that I won't be able to provide for my employees as a private practice business owner. I'm burdened with stress for making decisions that affect our staff and patients regarding elective procedures and visits. I feel like I'm waiting for the inevitable and it's going to be terrible. I have anxiety about the possibilities ahead, the quantity of the ill, but also the lack of adequate staffing to address the need. I'm feeling panic, mostly coming from the unknown. To what degree will I be asked to sacrifice my health and safety for others? And at what cost and what do I owe my small children and family? I feel pressure as I don't know. I wonder if I can successfully use personal protective equipment and precautions carefully to protect myself and others. And also some panic about the chaos at work when it feels like hour-to-hour changes are happening with testing and recommendations without notifications and updates. So that's kind of the sense that I've been getting from a lot of the people I interviewed. And so what we're really going to do now is focus on the anxiety and fear about the unknown, not necessarily about getting sick, but about the unknown. So we're going to just jump right in. Remember, you always want to get your severity level of how strong you're feeling that emotion and write down where you can feel it in your body if possible. And let's get started. Even though I'm feeling anxious about whether or not the system is appropriately handling this virus, I love and accept myself. Even though I'm having some uncertainty and anxiety about how the system is handling this crisis, I love and accept myself exactly as I am in this moment. Even though I'm feeling anxiety and fear about how this illness is stressing the healthcare system and how that's going to affect my life, I love and accept myself, and I know that I am doing everything I can in the moment, even if that just means getting through the day. I feel anxiety. There's so much uncertainty and fear. I feel like I'm waiting for the inevitable and it's going to be terrible. I'm worried about how many sick people there are going to be. And I'm worried if there's going to be adequate staffing to address the need of the time. At what cost do I sacrifice my own health and that of my family for this pandemic? I have anxiety about so many things related to the system right now. It feels like chaos at work when all the recommendations are changing hour to hour and we just can't keep up. So much anxiety, so much fear of the unknown. How can we all stay updated and do what is correct? Who even knows what correct is and how we're supposed to manage our patients? So many possibilities lie ahead, and I don't know what they are. I don't know how it will turn out. I feel so much anxiety about having to make decisions that it's going to affect the livelihood of my staff and patients. I'm anxious about making all these decisions for my healthcare system. I'm doing the best I can, but I don't know if it's enough. I'm afraid I'm not going to be able to provide for my employees. What's going to happen to all the people that depend on me if they're not able to make their living? How is my family going to be affected by the social distancing? How are my kids going to get the correct education? And who's going to take care of my kids all day while I'm at work? So much fear and anxiety. There's just so many possibilities of what could go wrong, and it's overwhelming. All this fear and anxiety. All right, so let's pause, take a deep breath in and out. All right, so let's check in with the severity level of your emotion of the fear and anxiety. Has it gone down, gone up, stay the same? Is it possible that there's something else causing fear and anxiety that I haven't touched on here? And if so, maybe you can um, check in with that and change some of your responses to what I'm saying to fit in more with that. Remember, you don't want to repeat something if it's not resonating with you because it's not really going to be as effective that way. And I obviously can't be there with all of you. And any aha moments, new emotions, triggers, memories, images, anything else come up for you, ideas of how you can, um, work better in the system or better help your employees or your patients, or wait, solutions of what you're going to do to help people with their finances. And check in again with your anxiety level. If it is a 3 or below, you're good and you can skip ahead to the tapping in the positive. I'm going to go through one more round of tapping for the anxiety. And so we'll just go right back into that. I feel so much anxiety. I feel like I'm waiting for the inevitable and it's going to be terrible. I have so much responsibility for the people in my life. And I have so much anxiety that I'm not going to be able to take care of them the right way. Not only do I have to take care of patients, but I have to take care of my employees and my family. And who's there to take care of me? How far does it go in terms of the sacrifices that I make for this job? Am I going to be able to successfully protect myself from getting this disease? What's going to happen to my family members who are not at home right now? So much anxiety, so much worry and panic. I'm worried about my ability to take care of all the people that I love. I worry that I'm going to not be able to provide for my family and that my employees won't be able to provide for their families. How far does this go in terms of putting myself at risk? How bad is this going to get? I'm anxious about all the possibilities that lie ahead. I don't know if there's going to be enough staffing to address the need that we have. And I'm have anxiety about not knowing how many people are going to get sick. I have a lot of anxiety about the unknown. I feel like I'm waiting for the inevitable, and I feel so powerless. So much anxiety and fear. All this anxiety. So much anxiety and fear. Okay, let's stop. We'll take a deep breath in and out. Check in with how you're feeling. How strong is the anxiety on a scale of 0 to 10? If it's down to a 0, 1, or 2, you can move ahead with the positive. And if it is still a 3 or 4 or above, rewind the video and go back in for another couple rounds of what we just did. And we're going to move ahead to tapping in the positive. But remember, if you don't feel down to a 3 or below, really stick with the positive, with the negative right now, and come back to the positive when that's better. Any other aha moments, new emotions coming up, tap on those. Okay, it's really important. And if you have any ideas, make sure to write those down because those are going to be really coming from your body's most calm, rested place. So let's tap in some positive. All this anxiety I have, I can feel it starting to leave my body. I've always tried to stay in control of everything. And I'm grateful to learn this lesson that I can't control everything. Maybe that's something I can take with me moving forward after this epidemic. All this fear and anxiety, I feel it leaving my body. I know I'm doing everything I can to take the best care of the people in my life. And it's okay if I don't have all the answers. It's okay to use my energy on making a difference. I'm open to the idea that I don't have to use my energy to obsess about the future. I can trust my intuition to tell me what the right thing is to do. And I'm going to do everything that I can for my family and for my employees and my staff. Feel this anxiety leaving my body, feeling so much more calm. Such a relief to feel this lightness. I have so much more mental energy now to really focus on the people that I love. All right, let's stop. Take a deep breath. What came up while we were doing that positivity? How are you feeling? Hopefully, a little lighter, a little more calm. Again, I'm as in the last video. I feel so much better even just going through this. I feel a nice wave of calmness over me, and we're going to do the best we can. And you are amazing, and thank you for all the work you're doing to take care of patients and family and colleagues and staff and doing everything really going above and beyond and doctors are asked to be superman, superheroes, superwomen all the time, and this is just one step even higher. So make sure you take care of yourself, you do what you can um, to keep yourself healthy. And in the next video we're going to talk about anger and resentment. And I hope you're finding this helpful. If you have any questions or comments, please let me know. And of course, if you need more help than these videos, please do reach out to the mental health professionals that can help you. Remember to wash your hands after doing this video since you've been touching your face. And I'll see you tomorrow for the next video. Thanks so much for joining.